this video will just demonstrate the mechanics of removing a foreign body from the eye. So common things we see is definitely metal. They can be quite difficult to remove, especially if the patient presents 1 or 2 days after it's gone into the eye, and they can also have a rust ring remaining, which we can try and remove as well. So for this example, this patient has a bit of blue tack stuck to their eye, which if I widen this, you can see just here. Obviously foreign bodies aren't that easy to see usually. We would stain the eye with fluorescein 1%. If you don't have that, then dilute fluorescein 2%. You can dilute the fluorescein with proximeticaine, which is a numbing agent, and the patient's eye will need to be totally numb before you can attempt to remove it. So I have applied proximeticaine to this imaginary eye and fluorescein, and I've wet a sterile cotton bud with saline. I'm just going to see if I can remove it with the cotton bud only. So you're going to make sure your light is adjusted onto the foreign body. You're going to be using the slit lamp to get a really good magnified view. And I find resting your elbow on anything at the right height just steadies your hand. So you're just going to warn the patient you're just coming close to their eye, and you're just going to use the wet cotton bud just to see, can I just flick that off of there? And I'm looking through the slit lamp as I do it, but that just isn't budging. So it's going to explain to the patient that it can be quite scary. You're coming towards the eye with a needle. So I usually use a green needle and a 5mm syringe, and just, you do need to keep the safety catch on, but just make sure you just keep that out of your way, and unsheath the needle. And what we're doing is using the bevel, the end of the needle here, and we're just going to flicking or scraping slightly the foreign body. We're always running this way, parallel to the patient. We're never going at this angle. So steady your arm, and just make sure your light's in the right position. Make sure you've got a good view on the slit lamp, and just talk to patients, just warn them to stay very still. They won't feel it. We've established with the cotton bud they are numb, and we're just going to gently just keep flicking, and then it's not usually as dramatic as the blue tack, but that metal would flick off. Okay, just make sure you remove your needle, put the safety on, and put that straight away into a sharps box. Sometimes the metal will remain and it's come away, but it's still stuck on the eye. So use a clean, sterile cotton bud. There are plenty in the eye room in the department. Moisten it with saline and just go back in. If you just imagine where I was, let's pretend the metal's still there, and we're just going to get it onto the cotton bud and remove it. Okay, just do try and reassure the patient as well. It is quite a scary procedure for them. Just reassess, and I'm quite happy now all that foreign body has gone. Luckily there's no rust ring remaining. Rust ring would look quite brown, and you can remove that again with the needle. If you're unsure, don't. Just come and ask one of the practitioners, will happily help you. Okay. And the next.
We're now going to demonstrate the removal of a foreign body from underneath the eyelid, and this is how you invert the eyelid.
So if you just want to close your eyes gently, take hold of the lashes, hold the stick there,